I appreciate you spending your time with me tonight, and I can promise you that I will make it worth your while. What we're going to talk about tonight is a method by which we can not only accelerate orthodontic tooth movement, but as a result, we can increase the satisfaction levels of our patients. We can reduce the chair time spent doing our 6-month smiles cases. As a result, that will lead to more profitability, probably more referrals as well, as this is actually kind of a buzzworthy item. This is something that we can do that's very unique in our practices that actually helps teeth move faster with no additional forces, and that's very important. So we're going to cover all the biology and all the science behind this technique tonight. I've been doing this now for a little over a year using the Propel system, and like I said, I'm going to cover the different techniques. There are actually a few different ways to deliver this service for your patients. I'm going to cover those as well, and we'll just start with what the learning objectives are for tonight. We're going to discover the concept of accelerated orthodontics. And we're also going to review the history of micro-osteoperforation techniques. We'll certainly cover the benefits of using this technique in your practice. We're going to talk about how to identify good cases for the technique, and also step-by-step how to perform micro-osteoperforation. Also, we're going to review verbal skills, how to present this to your patients, because this is something that you can increase your profitability with in your practice in several different ways. I'll give you a few different ways that we're doing it in my practice as we move through this webinar. And also how to get started. You know, what do you need to do to implement the micro-osteoperforation procedure in your practice? So first of all, that's me, Chris Bowman. I'm a full-time general dentist. I've got a practice in Charlotte, North Carolina. And as Mike said, I'm an instructor for 6-month smiles. I am an Invisalign preferred provider as well. I should have taken that out for the 6-month smiles webinar. I'm a founder of Dental Insiders Alliance, and I also have a 2-day communications course called the Get More Yeses Advanced Dental Communications course, which has been pretty popular over the last 3 years. My email address, if you'd like to write that down, it is chris@dentalinsiders.com. chris@dentalinsiders.com. Go ahead and write that down. And if you need to email me after tonight's webinar, feel free to do so. I'm happy to reply to you with any questions you may have. Here's some disclaimers. I am a clinical instructor for 6-month smiles. I do not own stock, securities, or interest in any dental company. Neither do any of my family members. We're not employed by any dental companies other than 6-month smiles, and I do receive some payment from Propel Orthodontics, and don't receive payment from Solution Reach, but I have spoken on their behalf in the past as well. This is my family. That's my wife Elizabeth over there on the left of your screen, and then in the middle, the tall one is Reed. He's 12. Keenan's on the right, and Olivia is 9. Keenan's 11, and I think you can figure out which one's which. All right, there they are having fun. Olivia, that is not our horse, but she does ride horses, and Reed and Keenan messing around. I think that's in the mountains of Utah. We like to have a lot of fun and travel as a family, and actually 6-month smiles has been a reason why we can do more of that. So there's my dental team, by the way, with the downtown Charlotte skyline in the background. We are a very high energy and focused team. We really like to do things at a high level and do things with excellence, and we always strive for that. We're never 100% satisfied, which I think is a key to success in my opinion. But that's them, and I couldn't get where I am today without their support. The team drives the practice, and everything from the things that they do to how they communicate with patients, the team is the key. So make sure you take care of your team in your own practice. So let's go back to the problem here. Here it is. Adult and adolescent patients want straight teeth. And as we all know, in taking the 6-month smiles course, a lot of patients haven't really liked the answers that they've gotten with regard to how to straighten their teeth until maybe they hear about something like 6-month smiles. Orthodontic treatment times are considered lengthy to patients. Anything more than 6 or 9 months would be considered a long time to wear braces or aligners for that matter. Most would prefer abbreviated treatment times. I mean, think of all the times a patient's asked you, how long are these things going to be on here? How long am I going to have to wear the braces? Many patients, as we know, will either delay or even decline treatment because of their perceived treatment time and their perception of how long that is to get the results that they want. Many patients would buy speed if offered the opportunity. What I mean by that is they will pay more to get it done faster. You know, I've always said that a gallon of milk costs a lot more in a convenience store than it does in a grocery store. And the reason why is because you can get it a lot faster. You don't have to walk all the way to the back of the store to get it. Doctors who don't offer accelerated tooth movement will likely lose patients, and they'll lose opportunities to get cases done more profitably and faster in their practices. So here's the solution. You should consider offering accelerated tooth movement techniques in your practice. There are different options available to doctors. The modalities are getting easier and less invasive. Fewer appointments and less doctor time is required for these things, and the compliance is not required with some of the options. We'll go over those tonight. When you can get fast and effective results faster than expected, that generates what I said earlier, that buzz factor, which creates word-of-mouth referrals. Patients will tell other patients or other people about how they got their teeth straight in 4 months or 5 months instead of 7 or 9 months. And doctors who do offer this option in their practices will likely gain patients because of all those factors above. So let's go over the science behind micro-osteoperforation accelerated tooth movement. It all starts with what we call bone injury, which sounds like a bad thing, but in our context tonight, the injury that we're talking about is really not a true injury, even though, you know, technically it's an invasion, we'll call it, in the bone. But that injury causes inflammation, and when inflammation happens, you get increased cytokine production, you get an increased rate of bone remodeling, and then you get decreased bone density when the bone goes into repair mode. So let's talk about how micro-osteoperforation works. We know that the rate that the bone remodels determines the speed of tooth movement. In other words, how long does it take an osteoclast to break down in front of the tooth movement? How long does it take an osteoblast to rebuild bone behind the tooth movement? That rate will determine how fast a tooth moves, along with the force applied and so on. Decades of research refined into a simple and easy in-office procedure using micro-osteoperforations can move teeth faster, and now it's easier than ever, and it's been clinically proven safe. Studies at New York University School of Dentistry have shown that you can increase tooth movement by 2 to 3 times the normal movement with the same amount of force. So dense bone can temporarily be softened internally through micro-osteoperforation, and the patient doesn't notice this, but this allows the tooth movement to occur faster and easier. So this schematic drawing will show you how when the force is applied to your right, as force is applied to your right, the left side of the tooth, the side away from which the tooth is moving, will be what we call the tension side. In that side, there will be cell proliferation and fiber production. In other words, a backfilling of bone tissue and fibrous tissue as the tooth moves away from that. On the pressure side, when the tooth moves towards the pressure side, you'll have fiber disorganization and breakdown, decreased cell proliferation, and also fiber production. So that's where the vascular constriction occurs as the tooth moves toward the pressure side. So again, as the tooth moves this way, these things will happen. So here on the frontal side, on the pressure side, you'll see osteoclast breaking down bone and paving the way, so to speak, for that tooth to move in that direction. Again, here we go, moving to the right, and there go the osteoclasts breaking down the forward bone. And there goes the tooth, moving bodily as long as those osteoperforations are made along the root surface of the tooth. If you use a force that's too heavy, heavier than the rate at which the bone can remodel, then you will get an undermining resorption, and you'll get increased or undesirable amounts of tipping, and you'll get an uneven tooth movement. So the bone remodeling process involves all these different types of cells, the pre-osteoblasts and osteoblasts, and on the breakdown side, osteoclasts and pre-osteoclasts, and of course the vascularity has a lot to do with it, along with monocytes and macrophages. So again, we go from resorption of the bone to reversion to formation of new bone, and then remineralization of that newly formed bone. And this is the cellular processes that the bone goes through as it remodels when teeth move. So if we can speed that process up, we can accelerate the rate at which teeth move, without having to change the forces that we apply to the teeth. So, I came across this analogy a while back after observing an anthill. I mean, we've all seen an anthill, and I hope this video will work out okay, but I want you to see how this works. What I'm going to do is I'm going to use my foot and kind of brush it across the anthill in this brief video. This video is about 15 seconds, and I want you to watch what happens. Now, we all know that there are ants underneath this dirt here, and they're probably not moving very rapidly. They're probably working inside there, but they're probably not doing a whole lot. But when you brush your foot along this anthill, watch the rate at which the ants start to proliferate. So here we go, getting ready to kick over it. Just a little brush over it. Now look at these things come pouring out. Now the analogy here is that as the bone perceives that there is a micro-osteoperforation or a little dimple made in the bone cells will go into an overdrive repair mode. And the osteoclasts and osteoblasts will turn over about 2 to 3 times faster, thus increasing the rate of tooth movement. So let's look at the New York University clinical study. They utilized micro-osteoperforation. They used a specific device by Propel Orthodontics to create these little dimples through the gums and into the bone, just barely into the bone by a few millimeters. What they found was that this process reduces treatment time by 62%. And a clinical trial demonstrated a 2.3 times increase in velocity of tooth movement, specifically in canine retraction when using micro-osteoperforation. That was the specific movement that they tested. Now, you know as well as I do that canine roots are perhaps the largest and strongest single roots in the head. So when you can increase the rate of a canine root by 2.3 times, that's doing something. So that's pretty successful. Bodily movement of the tooth was shown, not tipping, which means that the micro-osteoperforations were successful in accelerating the rate of bone breakdown and remodeling across the entire length of the root. And then patients reported little to no post-treatment discomfort. So here's the study. Now pictures A on the right and the left will show you the left side has been treated with micro-osteoperforation in the same patient, and the right side is the control. So now that's the left side of the patient. In other words, the photographs on the right of the screen. In pictures B, left and right, you will see that on 24 hours after treatment, the soft tissue is completely healed from the micro-osteoperforation. So you can't even see where it was done the day before. And if you look at pictures C and D, you'll see that on the left side of the screen, on the patient's right side, tooth number 6 has not really moved that much after 28 days with the same amount of force applied from the TAD in the spring. However, if you look on the right side, which is the patient's left, tooth number 11 has moved considerably more after 28 days than it did on the right side. And again, in picture D, you'll be able to see that difference pretty clearly from the occlusal view. So let's take a look now at modalities in accelerated orthodontics. And by the way, this modality can be applied throughout the arch, whether you want to focus on specific stubborn teeth or if you want to focus throughout the arch in helping all the teeth move more rapidly throughout treatment. So there are some other different techniques that have been attempted and used in the past. The one on the left I've not used before. It's light activated bone regeneration. These are patient-controlled movements. It requires patient to self-administer the treatment for 20 minutes a day. Certainly relies, of course, on patient compliance, and you can see that that's quite a bit of an apparatus to put on the face there every single day for 20 minutes. Not sure if that's going to happen. Now, many of us have also heard about vibration technology, and I've got a little secret for you a little bit later regarding vibration technology. But the older vibration technology involves a rechargeable device with a vibrating mouthpiece that you bite on for 20 minutes per day. Now, historically, this device has a pretty high price tag to the doctor, about $800 per device, roughly. And if you don't want to lose money on it, you're going to sell that to your patients for $800 plus. If you want to make a little profit, you might even add to that, which significantly adds to the cost of the orthodontic treatment for the patients. So doctor-controlled accelerated orthodontics has had quite a history. The two different procedures you see on the left of the screen and in the middle, corticotomy and piezo surgery, are obviously, as you can see, very invasive. They involve a lot of cutting. Of course, a corticotomy involves a flap procedure. It's very time intensive, requires a lot of recovery time. It is not something that I have performed, nor something that I ever will perform. And as you can imagine, it's not something that patients really like to request. It's a pretty intense procedure. It takes a lot of intense training for the clinician as well. Piezo surgery is a little less invasive than a corticotomy, but it still requires a flap or tunnel procedure. It requires significant cutting and healing time, has a high cost, and also requires extensive training. Now, the micro-osteoperforation technique, as you can see, is what we like to call micro-invasive. It's minimally invasive when it comes to making a small puncture through the gums and into the bone. We're only going to puncture into the bone between 1 and 3 millimeters. Patient recovery time is negligible to none. About half the patients will report some soreness the night of the procedure and virtually no soreness the next day. Very little cost to the patient, very little cost to the doctor. The training is very easy for the doctor, and it's just an easy procedure to perform. And there are different ways to deliver the micro-osteoperforation. And these are the different methods. Now, the two methods that you see on the left and in the middle are for a handheld micro-osteoperforation device. Up until the reusable handpiece came available, I was using the device in the middle, which is this one right here. This was a handheld device, and basically you push a little button right here, and this piece here is replaceable and disposable. This would pop off, you put in a new piece, and these guides are depth guides that show you how deep you're going through the gingiva and into the bone. The disposable tips make it very inexpensive to provide. It's a large handle, it's very ergonomic, it's easy to use, and it's very similar, it's actually almost identical to driving a screwdriver through drywall. I know that's not a very sexy analogy, but that's exactly what it's like. You place it on the gingiva with either very strong topical anesthetic or mild local anesthetic. I've done it both ways, and both ways are very successful. And you just apply firm pressure and just a light turning force until you achieve the desired depth, and then you just back it right back out. Literally takes between 5 and 20 seconds to do each micro-perforation. This is the newer device that's been out for about 6 to 8 months now. This is an electric handpiece that turns at a revolution of 2 seconds per revolution. So in other words, 30 RPMs, 30 revolutions per minute. It turns very slowly, which is very effective for this procedure because it's extremely minimally invasive. It generates zero heat, and it's very easy to use for patients. This is a great little device. It even has a little reverse button right here, which allows you to back it out very easily just by pushing this button, that button right there. So here's the handheld device again, a little close up. These are the disposable pieces that go in it. You can see one has a depth gauge and one does not have a depth gauge. This depth gauge will slide as you go into the gingiva and into the bone, and then when you hit these different lines here, this is 3, 5, and 7 millimeters deep. So let's look at the benefits of micro-osteoperforation. Obviously for the patient, minimally invasive. It's performed chairside in just a few minutes. You can use it with aligners or with brackets. It does help to release difficult or stubborn movements, and it obviously accelerates treatment. Basically, you can turn a 6-month case into a 4-month case. You can turn a 10-month case into a 6 or 7-month case. The predictability of the treatment is increased when you are more confident that the teeth are going to move more effectively. Patient recovery time is a non-issue. The doctor controls this procedure, by the way. We don't have to rely on patient compliance. And it saves time, it saves chair time, and of course that'll mean that the patient will have to spend less time in the office, and that'll also increase our profitability. This is a cutting-edge treatment modality for patients. Treatment acceptance actually goes up when you can tell patients that it's going to take less time to get their teeth straight. Some doctors don't even charge any extra for this procedure. Now, I would recommend that you charge for it because I think it's it's something that should be charged for, and you can charge for it. Patients will pay for this. It does attract new patients. They're looking for faster, easier ways to get their teeth straightened. I mean, people want something, they want what they want yesterday. It seems like we can't get things to patients fast enough nowadays, and they will embrace this new technology. This can be presented as a premium treatment option to your patients, and I'll get to this in just a minute. And it also helps to reduce what I call treatment fatigue or burnout. You know, at the end of treatment, sometimes patients get a little tired of wearing their braces or for that matter, wearing the aligners. By accelerating the tooth movement, you can help things move faster for the patients, and it gives them a much better feeling that you are on their side as you help them with this treatment. So here's some considerations when you are evaluating a patient for a case. Most patients will require 1 to 2 treatments depending upon the complexity of the case. The complex case may require as many as 3 treatments. As far as how long the effect remains in place, if you look down toward the bottom, you'll see osteoclastic effect peaks in 24 hours and remains elevated for 10 to 12 weeks. What that means is that the effects of the micro-osteoperforation last around 3 months or so. So I'd say somewhere between 2.5 to 3.5, maybe even as long as 4 months, you'll see the effects of micro-osteoperforation. In cases where I've delivered this twice, I've repeated it somewhere between the 3 and 4 month mark for a patient to help their case move faster. 2 to 3 perforations per root, mesial and distal, as long as you have enough bone between those roots, and you can easily evaluate that using a Panorex. You don't necessarily need 3D technology. I don't use 3D technology at this point, and certainly not to evaluate a case for micro-osteoperforation. You want to perforate around the rate-limiting movements first. In other words, focus on the that look like they have the most challenging movements, whether they be rotations or extrusions or intrusions, any kind of movement whatsoever, bodily movements. Focus on the movements that you feel are going to be most challenging. Make sure you perforate around those teeth, and then you can certainly perforate elsewhere in the mouth to speed up the teeth everywhere. You know, sometimes you need to speed up tooth movement in teeth adjacent to the more difficult tooth in order for that tooth to move more easily. So don't forget that you don't want to just do this around the stubborn teeth. You want to do this, in my opinion, do this everywhere, wherever you can. As far as how deep you want to perforate, in the anterior, usually it's about 3 millimeters, 3 millimeters deep. Now that's 3 millimeters from the gingiva. So you're only going to be going about 1 millimeter into the bone, considering that the attached gingiva is about 2 millimeters thick. In the posterior, where you're going to have thicker gingival tissues, you're going to perforate somewhere between 5 and 7 millimeters. And if you're going to go to the palate, which is actually quite easy to do, you'll want to go between 5 and 7 millimeters as well. All right, so again, there's 3 easy steps to performing this procedure. The first thing you want to do is evaluate the treatment area. You can use a Panorex, like I said, or bite wings are also great to use. Palpate the tissue. Feel the indentations in between the roots of the teeth. And using this diagram over here, you can either make a triangular pattern where you have 2 perforations in the apical region and 1 about mid-root, or you could do a vertical pattern of 3 perforations. And you want to start about 2 to 3 millimeters below the cortical height of bone, and then start there and then move apically with your perforations. About 3 per area between the teeth is ideal. I've had many cases where I could only really feel comfortable doing 2 perforations, and that also works well. I try to get 3 as much as I can. Now, before the patient starts the procedure, you'll want them to rinse with chlorhexidine 2 times for 1 minute each, and that's merely as a precaution to reduce the oral bacteria. Since you are going to be making a perforation in the bone, we don't want the oral bacteria to be entering the internal bone. And then you anesthetize. Now, you can either anesthetize locally, which a lot of general dentists, of course, are very comfortable doing, or you could use some very strong topical anesthetic. Now, there is a very strong topical that we have in my practice that we get from a pharmacy out in California, and it involves tetracaine, epinephrine, lidocaine, prilocaine. It's a goopy mixture, and within about 3 to 4 minutes, the gum tissue is going to be numb for about 30 minutes. And I've even tried this myself, and I even feel like in the upper anterior region, for example, and lower anteriors, my teeth even feel numb when I use that stuff. So it's very powerful. It absorbs very well. So here's the tray setup. It's very easy. You've got your topical anesthetic here. What I do is I put it in a large syringe and just dispense what I need when I need it. We have cheek retractors here. The scissors are to cut 2x2s. So what we do is I cut a length of gauze and apply the topical to that gauze and apply that to dried gingiva. And you'll need this length if you're going from canine to canine. If you're going from premolar to premolar, you'll use a length about this long. And then, of course, here's the handheld device. Now, again, if you're using the electric handpiece, you will attach that to your unit. And then this is the disposable tip that you use per patient. Of course, you won't need to use this if you're using the electric handpiece. In that case, there is a little burr that is literally shaped like a little screw, and it goes in a latch type handpiece, just like a slow speed, and it fits in just like that. Here are the topical anesthetic instructions. Make sure the tissue is very dry. Cut the gauze at the desired length. Then place the perforation, place in the selected perforation areas. Let it sit there for about 3 to 4 minutes, and then wipe off the excess and rinse it off. And then what you want to do is allow 5 to 10 more minutes for that topical to penetrate, and then when you come in the room, that patient's not going to feel anything in their soft tissue. I've done many cases with just topical, and I've done many cases with with local anesthetic, and either one very effective. So while numbing takes place, certainly you can go into another room and get something else done. All right. So here's a close-up of the model I showed you earlier, showing the patterns that you can use. Basically, you want to approach this at a 90-degree angle, and when you're finished, it looks a little bit like this. In some cases, you will see a little bit of bleeding oozing out of here, but that usually stops within about 5 or 10 minutes. And I haven't really had any cases where any bleeding is extended longer than that. As far as how deep to perforate, once again, in the anterior regions, you're looking at about 3 millimeters of perforation depth. In the posterior, 5 to as much as 7 millimeters. In the mandibular, I would say probably better to go between 5 and 7. In the maxillary, most of the time I'm going to be perforating 5 millimeters deep. You can tell when you get through the cortical plate and you get into the bone, the cancellous bone and alveolar bone is a lot softer once you get through that cortical plate. So it's literally just like screwing a screw into drywall with no stud. Once you get through that drywall, it gets a whole lot easier. All right. So with the single-use device and the reusable handle, this is the reusable handle device that I would recommend if you're going to go to the handheld route. Ever since I've used the electric handpiece, by the way, I will tell you that I have only used this handheld handle one time since I've gotten the electric handpiece, and that was only because I forgot to recharge it. So yeah, I would highly recommend that you consider getting the electric handpiece if you're going to do this, because it is much easier for you and the patient, even though I will say this is easy as well. So you hold it at a 90-degree angle, and you rotate clockwise to perforate, and then you rotate counterclockwise to remove. And then once that screw has disengaged from the tissues, you can pull it out and go to the next spot. It is so easy and it's so quick to do. This is the electric handpiece. Now this is again a latch type handpiece. This is the single use. We'll call it a burr. The single use device that you'll use here. It's a contra angle, and again it turns at 30 revolutions per minute. You want to select the appropriate torque, either 15 or sometimes 30 Newton centimeters. You want to increase the torque setting as required to reach the desired perforation depth. The RPM recommended setting is high, which is, once again, 30 RPMs, which in our world is not high, but it's high for this machine. Once you've made your perforation, you just want to use your thumb with finger pressure to help make the perforation. Once you get to the desired depth, then you'll stop the device by pushing this button, and then you'll push this button to reverse it, and then push the start button again to back it right back out. So it's very easy to use. and once you're finished, you remove the tip, throw it in a sharps container, and you are done. It is extremely easy to use, and again, you've got two different modes with this. You've got pressing the start-stop button briefly to start the rotation and stop the rotation, and then the temporary method, which is you press and hold the start-stop button, and then it stops immediately when you release the button. I actually like this temporary mode where I can keep my finger on the button, and then just when I lift up, it stops. It just works for me. Now here's a brief technique video which will show you the handheld motion. I don't quite have the electric handpiece video yet, but this will show you how easy it is to make one perforation. As you can see, I'm going in with a clockwise motion using, moderate force. It pretty much goes in by itself once you get going. Now see, I've gotten to the first line there, which is 3 millimeters, and I'm just backing it out, and there we go. You can see it's just a little bit of bleeding there trickling out, and that's what your typical micro-osteoperforation looks like. That took about 15 to 20 seconds start to finish. So again, how many do you need to make? Once again, you'll make 2 to 3 in each space between the roots where you desire to make the perforations. You can either use the triangular pattern or a vertical pattern. And now some areas, because the vestibule is really shallow, or you may just not have a lot of room, you may only be able to make 2 perforations, and in some cases may be only able to make 1. I would recommend to try to make at least 2, preferably 3, in each area using whichever pattern you prefer. Now with the liners, you can use the same procedure. Again, you can change your interval of changing aligners to 7 to 9 days versus 14 days. So again, you can take an aligner case, for example, with a 5-day interval instead of a 14-day interval. And if you have 10 aligners, your follow-up visits are going to be every 4 to 5 weeks. And then your second acceleration could be at aligner number 20 if you have a case with that many aligners. And the same thing with different types of intervals. Obviously, you can accelerate the movement if you shorten the intervals of change in the aligners. You just want to make sure when you do this that the patients are tracking properly. Now with brackets, there's 2 different ways to look at this. Now I prefer to look at the proactive acceleration technique, whereas we've talked to the patient about this before treatment and they've agreed to move forward. And we're doing this to accelerate tooth movement from the get-go. You want to maintain the same biomechanics with the bracket system that you use, which in our case will be 6-month smiles. Maintain the same patient time frame between appointments, which would be 4 weeks. Toward the end of treatment, I will often accelerate that time frame. Now, I do have some patients who I've done micro-osteoperforations for, and they're actually coming in every 3 weeks, and in some cases they're coming in every 2 weeks in more straightforward cases. You want to perforate mesial and distal to the sites where mechanics call for the greatest movement, and like I said before, I actually perforate in as many areas as I can. So many cases can be delayed by 3 to 4 difficult teeth. I call those the unruly teeth. Well, you can focus in those areas if you prefer to minimize the number of perforations. You can focus in those areas and still get really good results. So, you can accelerate mesial and distal to difficult movement location when the arch wire is engaged. You can fast track any movement by doing these perforations. So, and you're not increasing the forces. That's a very important point. A lot of patients think that you have to increase the force to make the tooth move faster. And I always emphasize with my patients that we're not doing that. We're actually using light forces with 6-month smiles. And again, if you need to do it again, you can perform this procedure once again at about the 3 to 4 month mark if you feel the need. Now the reactive technique means that you would use microperforations at the finishing and detailing, which would really help increase your control at the very end when you're tweaking the procedure, trying to get those last few teeth into position. So again, just like with all cases, 3 or 4 difficult movements can be the factors that are keeping you from finishing a case. If you focus on those areas, you can bring those teeth in line a lot quicker. So these are different ways that you can approach micro-osteoperforations in your practice. So again, here's some photographs of what the tissue looks like immediately after micro-osteoperforation. You can see there's a little minor puncture there, and again, that heals within 24 to 48 hours. As far as pain medications, I have never had to call in any pain medication for a patient doing this procedure. I don't anticipate you will need to either, but many of you may know that the NSAID drugs like Advil and Aleve, ibuprofen and such, they will actually delay tooth movement when you take them. So we recommend taking Tylenol for all of our orthodontic cases when patients have any soreness. So we all know that Tylenol is not quite as effective for tooth pain as ibuprofen is, but this is a very mild soreness that patients experience after this procedure, and I haven't had any patients tell me that they've had to take anything more than Tylenol for their soreness, and once again, the soreness doesn't last more than about 24 hours. All right, so again, malocclusions and micro-osteoperforation. I'm not going to read all these to you, but obviously any type of tooth movement that you desire can be performed with any of these tooth movements can be accelerated with micro-osteoperforation, because the principles of bone remodeling are the same no matter what kind of movement you're performing. So whenever we can accelerate that bone activity, we can enhance the speed at which we can perform all of these procedures. Let's talk about verbal presentation skills for a minute, because that's one of the areas I love to focus. I always start by saying give everyone the opportunity to say yes to or no to your best care. This is really important in every aspect of your practice. When I teach my 2-day communications course, this is the first thing that I say. And it's very important for your entire team and the doctors to understand that unless you ask your patients if they want this, they won't say yes. But if you ask everyone if they want something, more people will say yes than if you try to pick and choose who you think is going to say yes. So, how many times have you been incorrect with who you thought was going to say yes or no for that matter? So if you ask everyone, it's okay if they say no, but it's not okay if you don't ask. So it's very important to give everyone the opportunity to say yes or no to your best care. You want to use non-intimidating language. For example, use English instead of dental terms. Instead of saying we're going to drill holes or screw holes into your bone, we like to use gentle terms like, I like to use the term dimples. We're going to make little dimples through the gums and just barely into the bone. And to some patients that still might sound quite invasive, but you can show them with your finger how far this is, or show them with a perio probe how far you're going. It's not far at all, and patients really are not intimidated by this. Using analogies and word pictures, I've used the anthill analogy with patients to explain to them how the activity increases when the bone perceives that there is a micro-perforation. Present the opportunity to patients. In other words, how would you like to get your teeth straightened in about 40% less time than it would take if we didn't do this? Or how'd you like to learn about a way that we can make your teeth move even faster without using heavier forces? So that's the opportunity that a patient gets, is get their teeth moving faster and get them straightened faster than ever before. What that means is you'll be spending less time in your braces, and you'll get them off faster, and you'll be enjoying your new smile sooner. Those are the benefits of the procedure. You don't necessarily want to talk about how short the screw is. You want to spend more time talking about how the patient's going to benefit from what you can do for them. And then present the best options first. As a matter of fact, when we present the fees for Propel, we present the fee for 6-month smiles, including Propel, and then we back out the Propel if the patient wants to pay less for the procedure. I'll go over that in just a minute. So again, here's some different verbal skills you can use. How would you like to finish your treatment 50 to 100% faster? And bringing in the authority principle. Clinical research has shown that the teeth can move 2 to 3 times faster than without this technique. We call this accelerated orthodontics, making small dimples in the gums. And then my favorite quote, if you've been to my 6-month smiles course, where I'm an instructor, one of the things that I say throughout the course regarding things like interproximal reduction and bite guards, and in this case Propel, is this will help your teeth move faster. And it always helps to calm patients down if they get a little bit anxious about things like bite guards interproximal reduction, and in this case, micro-osteoperforations. And I already mentioned the anthill analogy. It's a very effective way to illustrate how these teeth will move faster. So let's talk about how to present this to your patients for a minute. Then I'll show you some clinical slides. This is called the takeaway sell, and what that means is we're going to include micro-osteoperforation in the fee. Now, in my practice, our charge for this is $500, so I'll present my 6-month Smiles fee including Propel, in other words, with micro-osteoperforation. And then if the patient happens to balk at the fee, or if they feel like the fee is higher than they expected, I will mention that they can get this procedure done for $500 less if they do it without the micro-osteoperforation. So in other words, if you take away the procedure, you can reduce the fee back down to what your normal fee is, but you present the first fee, including Propel, as your normal fee. And it is. That's my normal fee, including Propel. But then we take away. And also the benefits go away. So in other words, your teeth will still move quickly. They just won't move as quickly as they would with the micro-osteoperforations. More patients will opt for the best option when you present the best option first. And this applies, by the way, to all situations and procedures, not just 6-month Smiles. Now, you could also use what we call the standard upsell, which means you can add micro-osteoperforation as an option. Let's suppose you have a patient who's agreed to 6-month Smiles, they understand the fee, and they're ready to move forward. Well, you could say, hey Jane, how would you like for your teeth to move 50 to 100% faster? Well, we now have a new method that will allow that to happen, and it's an additional $500. Would you like to do that? So it is best to do this if you present it after the acceptance of orthodontic treatment. In other words, after they've said yes. Patients will sometimes view this as an upsell because that's what it is. It's an upsell. But it's a very genuine upsell. It's not like we're trying to get them to do something. We're just offering them an option. And that's the point. If you present this to a patient in terms of it being a beneficial thing for them, and it is, it's a beneficial thing for the patient, and you offer it genuinely and sincerely, then it's not going to be perceived as a high-pressure sales pitch. But if you're nervous about that, and if you're not comfortable doing it, then it's not going to come across as comfortably. And again, that's where the communications aspect comes into play. It is so important to be able to communicate this comfortably with patients. And what I found is the more you know about it, the easier it is to do that. And again, this applies to all situations and procedures as well. You can use the upsell concept with just about anything in your practice that involves different treatment options. And this may work well with cost-conscious patients. If they're talking about affordability as being an issue, you may want to start with a lower fee for entry and then include Propel as an option. And then the third method is a rescue sell. Now this is a little bit more as an interceptive technique during treatment where micro-osteoperforation is not included or was not included in the fee. And then maybe the patient declined the option and decided, well, I'll just do 6-month Smiles without micro-osteoperforation. A lot of times what will happen is within about 1 or 2 months, or usually 3 months, a patient will come in and they'll say, hey, how much longer am I going to be in these braces? And you just want to be honest with them. If it looks like there's about 3 or 4 more months, you want to share that with your patients. And of course, I would never recommend that you promise that because you never really know how long it's going to take to finish a case at the very end. What you can do for a patient then is offer micro-osteoperforation again as an option and as a solution to get finished faster. A lot of times once the patient experiences the braces for about 2 to 3 months, all the patients would like to get those braces off more quickly. So they may feel a little more motivated to accept the additional fee once they've started the procedure. So you can offer this as a way to turbocharge the treatment and get through the treatment a whole lot faster. And we've had many patients take us up on this during treatment because of the appeal to them of getting the braces off even faster. And it also helps you finish faster too. By the way, regarding insurance, you can get reimbursed for this. So there is a high potential for this. It is technically an alveoloplasty. It's a very minimally invasive alveoloplasty. So the way we code this is it's 7320. If it's done per quadrant, in other words, with 4 or more teeth in a quadrant, That's the code that we use. If you do 1 to 3 teeth in a quadrant, then we use code 7321. You can submit this to insurance per quadrant. So in other words, up to 4 submissions of this code per procedure per patient. And we are getting some insurance companies reimbursing us for this procedure. Here's the impact on profitability. Of course, you're going to increase your revenue, and if you increase your revenue by a greater amount than the cost to deliver the procedure, then you're going to make a greater profit. You will also make a greater profit through fewer treatment appointments, less chair time for the doctor, less chair time for the assistant. Also, that'll result in increased per appointment revenue. And then as far as your patients go, your patient satisfaction is going to increase. And this will increase the buzz factor and the word-of-mouth referrals. Patients that learn about this technique will be more inclined and more motivated to come to your practice to receive this procedure, which in the end will result in more cases. And then for you and your practice and your team, this is a bit of a wow factor to make these perforations and have a patient come back in just 1 or 2 months and see the tremendous difference that's been made just by doing this. So it's a really cool thing to offer in your practice. Okay, so let's look at some clinical cases. Now I'm going to go through these pretty quickly because I realize that we are almost 50 minutes into this webinar. So when I start this, I want you to start thinking about questions that you may have. So go ahead and enter questions in the question box. If you have a question, go ahead and enter that now if you haven't already, and we will get to those at the end of the webinar. We're going to look at aligner cases first, and one thing I wanted to focus on here is the accelerated time between aligners. In other words, instead of the standard 2 weeks per aligner, many of these cases are done in 7 days or less per aligner. So let's take a look at these cases together. Now, I'm going to go through these pretty quickly. If you'll just take a look here at the befores on the left and the afters on the right. This is a class 1 crowding case. It's a pretty standard crowding case, finished with aligners in 10.5 months instead of a expected treatment time of about 24 months. Now, we all know that with 6-month smiles, we could probably get this case done in about, I would say, about 9 months or so. It may take a little longer because of this blocked out lateral. But again, non-extraction case done in 10.5 months with 33 aligners and 3 micro-osteoperforation applications, no refinement. I mean, that's pretty powerful for an aligner case. And with 6-month smiles, we could probably get this done even faster. Okay? Here's another case from Dr. Thomas Shipley. Now, I want you to take a look at this. He had his patients changing the aligners every 3 days. A projected case of, well, it says 24 months. I would project with traditional braces, this case would probably take somewhere between 9 and 12 months. With 6-month smiles, if you're like me, this to me looks like a 6-month case, slam dunk, easy, all said and done. In this case, he was able to finish with aligners in 6 months. So I'm not sure about that 24 months. Looks like it'd be about a 9 to 12 month aligner case, about a 6-month case with 6-month smiles. My guess with 6-month smiles, we'd probably get this done with the perforations in about 4 months. All right, here's another case. It's a class 3 case with spacing on the top and a little bit of crowding on the bottom. As you all know, these can be tricky cases because you've got to provide a little more IPR on the bottom. This case was completed in 5 months using 2 micro-osteoperforation applications with 20 aligners. So again, 5 months with 20 aligners, meaning the aligners were changed every week. Here's another case. Narrow arch, rounded out very nicely in 7 months, in other words, about half the time, using 3 micro-osteoperforation applications, a little more than you would expect here. But again, Dr. Nikizaisis got great results here using aligners with Propel. Would certainly take at least a year without Propel. And again, I'm zooming through these pretty quickly. If you have a question, just let me know. Here's an extremely straightforward case here, except for the fact that the occlusion's a little out of whack, and these laterals are really protruding quite a bit. But in this case, again, with aligners, performed in about 10 months, we're using 3 micro-osteoperforation applications as opposed to about 18 to 20 months. All right, here's another case, and you can see you can actually see that the micro-osteoperforations were done immediately before the pictures were taken. The aligner, 19 aligners performed in 8 weeks. In other words, changing the aligners about every 3 to 4 days. In this case, was completed in 8 weeks instead of 38 weeks. That's pretty tremendous. All right, and there's the finished case. All right, and here we go again. A deep bite case finished in 3 months instead of about 10 months using one micro-osteoperforation application from Dr. Shipley. And here's the after. That's pretty impressive. All right, and again, proactive. 15 months expected treatment time here, cut by a third using micro-osteoperforation. And again, you'll notice here, when you see the after pictures in the radiographs, you'll see that we've experienced bodily movement here, not just tipping. This is a bodily movement to close these spaces. All right, and again, another deep bite case with a severely lingually tipped canine, finished in 4.5 months instead of 16 months. And there you have it. I would imagine that many of you are looking at these pictures going, wow, I would love results like that. We're going to get to the brackets cases in just a minute as well. Here's another case done in 6 months. That would normally take about 17 months. Okay, now we're going to move to bracket cases. And once again, go ahead and enter your questions now if you haven't already for the Q&A session. Okay? So this is Heather before. Now, the funny thing about Heather is that when she came to my practice, she actually was pretty adamant and she really wanted aligners. And I sent her case off, and it was actually rejected by the aligner company. And the reason why it was rejected was because she had 2 teeth that had some pretty severe rotations, especially tooth number 10. They said that tooth number 10 was rotated more than 30 degrees, thus they did not want to take on this case with aligners. And as you and I know, if you've done aligner cases, that can be a very frustrating movement to rotate a tooth more than about 15 or 20 degrees with aligners. So we used 6-month smiles for her, and we used Propel. After just 2 months, you can see that she is almost finished with treatment. Now, she had some pretty severe rotations, and she had some pretty severe malalignment on the lower. It only took us an additional 3 months to finish her case by using Propel. I used one micro-osteoperforation. I just wanted you to see how quickly these teeth move after just a couple of months with Propel. Now, here's another case. This is Michael. Now, he has a severely rotated upper, all these upper premolars are pretty rotated. This one almost 90 degrees. This one's at least 45, maybe 60 degrees, and this one's about 30 degrees, and this one's also about 20 to 30 degrees. A very narrow arches. You can see he's got these V-shaped arches. Now, just 2 months after Propel, look at the amount of arch widening we've been able to achieve with Propel using 6-month smiles, a little IPR. And again, right here on the lower arch, same thing. He's got a couple brackets that we're repositioning that day. But again, you can see how much movement he's gotten in just 2 months. So my purpose here is to show you how quickly we can get these movements. Now, this is Mai. Mai came in, and she had a severely lingually displaced number 7. And also, if you take a look here at tooth number 23, it's at about a 45-degree angle rotationally and canted about 45 degrees as well. And this will give you another view of that tooth. So in just 1 month after using Propel with IPR and standard techniques, I don't even have a bracket on tooth number 7 yet, but you can see number 7 has now been moved into the arch form. So now all we have to do is derotate that tooth, but it's been moved facially in just 1 month into the arch form, and we've achieved more rounding out of the arch. This is 2 months after using Propel, and you can see that although we're not quite finished yet, you can see that we've achieved quite a bit of derotation in this area where that tooth was previously rotated at least 45 degrees. Also on the lower arch too, this tooth is almost completely uprighted after just 2 months. Now this is Ugomma, and again, braces on and Propel on the same day. You can see that she has quite a bit of malalignment, especially in the premolar region. On the upper arch, she's very narrow. She's in a bilateral crossbite. And here she is 3 months after Propel. Here I was using lingual buttons with elastics to derotate this premolar and get it kind of untrapped, so to speak. along with IPR. And again, just 3 months after Propel, you can see the amount of movement that we've been able to achieve here. Okay. Here's some other cases. Again, using brackets. This case was estimated to take about 9 months without micro-osteoperforation, but with Propel took 4 months using 2 applications of micro-osteoperforation. So again, really nice result, really nice arch development using micro-osteoperforations in just 4 months. So I know many of you took the 6-month Smiles course and were surprised to see how quickly those cases could be finished. Well, now could you imagine speeding that up by about 50 to 100%? It's really cool to do this. Here's another bracket case, again finished in just 2 months using 1 micro-osteoperforation application. Here's another case with severely lingually tipped lower premolars, finished in 9 months using 2 applications instead of the projected 18 months. Here's another case with an impacted canine, which is extruded and brought into the arch form. This case was completed in 6 months as opposed to the originally anticipated 10 months. And again, with Propel here, this case was turned into a 6-month case. Look at the amount of movement that we were able to achieve here with 6 months versus the projected 12 to 18 months without using Propel. Here's another case with a severe underbite, a class 3 case. Again, done in 5 months using 2 applications instead of the projected 12 to 16 months without Propel. This is a molar uprighting case. Again, when you can activate this bone to remodel more quickly, you can get results like this in just 3 months instead of the projected 6 months using the micro-osteoperforation procedure. So I'm pretty sure you can see by now the type of results we can get using this procedure. You know, in this case here, you can see the lower arch is canted quite a bit, and all that was corrected here in 4 months using 2 applications. And by the way, this case transferred from another orthodontist after 1 year of unsuccessfully trying to close the open bite. A year after completion of treatment, the bite remains stable. Here's another case with some very high upper laterals. Again, leveled out just within 1 month. Not quite finished with the case yet, but you can see how much movement occurs in just 1 month with the micro-osteoperforation. And again here, moderate crowding with a tooth completely blocked out. That case completed in 7 months instead of the anticipated 14 months with brackets. Here's another case, once again, corrected in 4 months, space closure case, corrected in 4 months. This molar was brought mesially by an entire tooth using brackets in 4 months using micro-osteoperforation. That's pretty powerful. All right, here's another one done in 12 weeks instead of 20 months, again using micro-osteoperforations. 2 applications were used here, and again this was to help close an anterior open bite, and you can see they achieved really nice results here with that. Here's another anterior open bite treated in 13 months instead of the projected 24 months. And again, a lot of these cases done at the New York University study. Many other of these cases, as you noticed, have been done in private practice. I want to thank you for spending this time with me.